Plastic surgery uses plastic as a part of its surgery. How true is it, or is it just a myth? Hi, I'm Dr. Deepthi Devarakonda, consultant plastic surgeon, Eternelle Aesthetics, and we'll rule out some funny myths that we hear regularly about plastic surgery. The most common and the most juvenile myth about plastic surgery is that we actually use plastic as a component for plastic surgery. No, we don't do that, and we don't even push plastic into people's bodies. Plastic surgery is derived its name from a Latin word called plastikos. Plastikos actually means something which can be molded or shaped into desired shapes and sizes. That's where plastic actually got its name, and also plastic surgery. The second biggest myth is the fact that plastic surgery makes people look fake. Yes, there were times initially when plastic surgery was done to bring a very spectacular change in people, sometimes leading them to look a little fake. But the modern trend, especially in the latest decade, the last few decades, the most common requirement from the patients is the fact that they want to have natural looking results. And all the methodologies and the procedures have been modified to give a most naturally looking look and not the fake look. So actually today's plastic surgery is making people look natural and beautiful and not fake and beautiful. And also, when you come down for a consultation to a plastic surgeon, don't come up with unrealistic expectations in terms of your outcome, and don't aim at getting results which is equal to some celebrity which you see on the TV screen. Give a free hand to the doctor so that they can analyze your face in toto and give you the apt solution which is ideal for your face or your body. This helps the doctor achieve more natural results than when they try to achieve a celebrity's look. The third most important thing that we hear from people is plastic surgery is only for those lazy rich people and not for the regular good lifestyle people, and you can actually get into shape of your desired choice with good lifestyle and exercise techniques. How true is this? I will never deny the fact that food, a good diet and lifestyle and regular exercises will not give you a good shape. Definitely they do help you achieve a good shape and size, but the plastic surgery actually aims in small contour deficits. Suppose you are in perfect shape and you have a very small infra-umbilical pocket of fat. That is very difficult to remove with specific forms of diets or exercises. Or suppose there is an extra fat accumulated in your arm. There's a small laxity of skin in your arm. These things are very difficult when you have to address with specific exercises. So this just adds up to your lifestyle and gives a perfect shape and adds up to bringing up your confidence. Coming to certain procedures in face, say it's rhinoplasty, or say there's skin laxity in the face, or blepharoplasty, these things definitely will not turn over by themselves with small exercises or lifestyle changes. These are specific changes that the plastic surgeon aims to achieve to give you a perfect result. Cosmetic surgery is dangerous. This is a common myth that runs around among many people. Is cosmetic surgery really dangerous? Yes, you might have to think about it in case you're going into the wrong hands. Please do your research very well before you choose your surgeon. They need to be trained plastic surgeons and also specifically trained for the procedure that you're opting for. In case you go to a surgeon who's not trained in liposuction, then definitely liposuction can be a threat to your life. And in terms of achieving results, please have realistic expectations. We see records of people who go for 20-25 liters of liposuction just to lose weight, though when actually liposuction is a contour-based procedure and not aimed at weight loss. Give a free hand to your doctor and let your doctor decide what is safe for you in terms of outcomes and also post-operative period. And also take care to discuss your entire medical history in front of your doctor, whether it's smoking or any drug abuse or any allergies or any surgical history that you had in the past. This just helps the doctor to plan your surgery much better and in a much safer way. Keeping away these facts from the doctor actually can result in chronic complications or long-lasting complications in the post-surgical time. And the last and the final myth that we are going to talk about today is this only for females? No, it's not absolutely only for females, and men are not ready to stand behind in terms of looks in today's generation. Whether it's hair transplant, whether it's a high definition liposuction, you can actually carve out your biceps, triceps, and there are various methodologies. And in terms of facial corrections, men are coming forward and also showing great interest in building up their confidence as much as women do. And if there is any further myth that's stuck on your mind which you want to get cleared, please share your comment below. If you like a video and feel that's helpful to you, please like and share this further to all your friends for whom plastic surgery can do miracles. Don't forget to subscribe to our channel.